Excited to have you all join us. We're going to be talking about separation anxiety today. Thank you for tuning in. We'd love to hear where everyone's from, and if you have pets joining us, whether they're your canine companions or your feline friends, or if you have other critters that are joining us. I'm Dr. Stacy from Pumpkin Pet Care. Welcome to our special guest, Karishma. Thank you so much for joining us. Karishma is from Canine Com Academy. If you're just popping in right now, today we're going to be answering questions about separation anxiety, providing lots of tips and tricks. We're going to be doing a deep dive into different types of therapies that can help your pets for separation anxiety. But I'd love to open it up to Karishma. She has very special training in separation anxiety. So Karishma, tell us more about the work that you're doing over at Canine Academy.
Hi everybody, thank you Dr. Stacy for that lovely intro. Just like Dr. Stacy, I'm so excited to have you all here, and a big thank you to Pumpkin for having us come and talk about this really important topic right now. So like mentioned, my name is Karishma Warr. I'm head of training and behavior at Canine Academy. We're a small team of dog training and behavior specialists who work with clients around the globe. We specialize in separation anxiety, and one of the qualifications I have as a dog trainer is a certified separation anxiety trainer. So about 90% of my private practice is treating separation anxiety clients. Thank you, Brett. And yeah, so it's really something I spend all day doing. I'm really passionate about talking about this subject. So excited to be here with Dr. Stacy as well, who has such an interest in behavior and behavior medicine, because for this particular behavior condition, it really is about treating the whole animal, and we have to look holistically at this. So I'm so excited to be here chatting today.
I'm glad that we're able to shed some light on this, because I think we'd all agree that kind of the mind and the body come together, and that's an important part of health. My background also is in behavior. So originally when I started in my education, I was studying psychology and biology with a concentration in animal behavior. And that always comes through in the exam room when we're looking at animals. A lot of times people are mentioning generalized anxiety or separation anxiety as part of the exam. So I'm glad that we're able to shed some light on it today. So welcome to folks who are just joining us now. So right now we're realizing that life has changed for so many of us during COVID. And some of us have spent a lot of time with our pets. So they've been spending time with us from dawn to dusk, and even in our beds. And right now, some of us are returning to work, and our kids are returning to school, and things are starting to change. So we're expecting to see a surge in separation anxiety. So I wanted to get a feel from you, Karishma. How do you expect the COVID dynamic to impact our pets in terms of stats with COVID and separation anxiety?
Yeah, and this is such a big and topical behavior concern right now, Dr. Stacey. I'm sure you're getting many more people asking about this particular behavior concern than maybe a few years ago. And that's exactly because there are going to be so many ways that the pandemic is going to affect our dogs and our cats with their alone time behaviors. So just some things to think about, I guess, first of all, is that so many folks adopted pets during the pandemic, right? So many of us took this as the opportunity to get that beloved furry family member that we always wanted, right? However, many of us have not been leaving for a really long time. So there are a few things that are going to tie in here. One is that the majority of these dogs, pretty much every dog and cat, is going to have not practiced being alone for a really long time, at least not consistently, right? And we know from the studies that one of the contributing factors to separation related anxiety is a sudden extended presence or departure of a family member, right? So we know that from our studies that if there's significant changes in household dynamics, for example, people are present for a long period of time and then leave, that can be a compounding factor. And we've never had a bigger event of humanity staying put for a big period of time, right? So we're really going to see that coming into play. I think additionally, a second thing to think about is that I read a study recently, 30% of dogs adopted from shelters in the UK are showing signs of separated related anxiety. So we've had a big increase in adoption, right? And we've had a big increase in folks staying home for long periods of time. And together, I think this is going to be problematic. Yeah, for sure.
Yeah, absolutely. I was reading a poll out of Michigan University. They said about 10% of US adults adopted a shelter pet during 2020. So there are a lot of brand new pets in the home. And yeah, you're exactly right. They've been quarantining with us. We've been just strengthening that human animal bond, which has been amazing. But once we transition, there will be prolonged lengths of stay at home, which is going to set us up for some issues. So I'm excited to kind of dive deeper into all of this so that we can do some preventative measures. And then also for folks who have their pets who already have separation anxiety, we can think about some therapeutic measures too. So awesome. So let's see. Let's talk about kind of the signs and symptoms of separation anxiety. I know that those are really, really varied. Some of the major things that I know I've seen are vocalization, destructiveness in the house, and just destroying things, things that are attached to the house, things that are inanimate objects, even house soiling. I'm actually curious to know if anyone here who's watching has had any specific household items that have been destroyed. I once had a foster dog who ate the stuffing out of my leather couch, and I actually had to stitch it back together with some non-absorbable suture because I'm a dog mom who doesn't sew. So I'm actually wondering, in your experience, if you've had any really notable stories of extreme separation anxiety where anxiety was taken to a whole new level.
Yeah, I mean, you're totally right in that comment you made about how wide-ranging the behavioral indicators are. And I'm sure we have folks all over America and maybe even farther afield in the chat today who have all different breeds of different ages, and they all look so different. So it's likely that they're going to be performing different behaviors as well. But you're totally right. The top three indicators we see are those vocalizations, so barking and howling, often, or whining. We see destructive behavior, like you mentioned, and that can be fixated on exit points like windows and doorways. But like you mentioned, sometimes they just go rogue and chew up the couch. And yeah, this is definitely not an attempt to get back at you in any way. It's purely a stress relieving function that for us, it would not particularly be stress relieving to rip up a door or a couch, but for the canine species and for felines as well, destructive behavior can be incredibly self-soothing. Pardon me. So we see the vocalizations, the destructive behavior, and then of course the house soiling. And again, this is often commonly mistaken for the dog or cat being naughty or trying to get back at the human being for leaving. And that's a very human way of describing what's happening. In fact, in most cases, we're seeing that these are behaviors that come from fear and panic. So we would call in behavior, in animal behavior, we'd call separation related anxiety a panic disorder of sorts. And I'm sure that it's sort of similar on the medical side. Would you agree with that kind of assessment?
Yeah, absolutely. And I like that you point out kind of that panic. And even when I'm prescribing medications, I look at kind of long-term therapy and also how we have to treat that panic. And so we actually have different classes of medication, and we'll dive deeper into that. So yeah, I noted that there are folks in the chat, they're mentioning different things that have been destroyed around their houses, and they are notable. One of the things that I saw in the chat is that there are a lot of electrical things that are being destroyed in the home, which is not good, because when pets are chewing on electrical cords, I think I saw an Ethernet cable out there that was chewed up. That can actually cause some significant damage to the lungs if a pet is electrocuted. So we should probably think about maybe cat proofing and dog proofing our homes. I know that those are two different things, to cat proof and to dog proof. So what do you think about the difference between cat proofing and dog proofing? Because those are very different creatures.
Absolutely, yeah, extremely different. I mean, they're making sure that the environment your pets are going to be staying in, that it's safe, is absolutely key. And I think one of the biggest things to do to animal proof in general, I mean, we'll talk about the differences, but the first thing is we need to get a camera in that space, right? I feel like no space is ever thoroughly animal proofed or baby proofed, even if there's not a camera in there so we can see what's happening when we're gone, because you'll be amazed at what they can get into. But I was thinking about it the other day, and I think me and Dr. Stacy were actually talking about how dog proofing, we really have to think on the ground level, and then for cat proofing we often have to think vertically as well, and that's definitely things that we want to be removing are any sort of edible items. We might want to be putting latches on cupboards or baby gates up around certain rooms so they can't get into certain areas. These are all things, remembering that, I've definitely seen dogs jump up on the kitchen counter and open a cupboard and help themselves to everything in that cupboard, for example. But I think very importantly, and I'm sure you'll agree, Dr. Stacy, is that we need to be avoiding putting animals in a state of panic in that way. For no animal is truly safe when they are in a state of panic. And I saw someone in the chat mentioned chewing on the bars of the kennel to the point that they damage their mouth. And it shows you that you can try and keep your animal as safe as possible by kenneling them, for example, or putting them in a crate. But even in that extremely sterile environment, that the animals are not truly going to be safe unless we deal with the underlying panic that they're experiencing. But those are definitely some thoughts. One actual, you mentioned a notable case of extreme separation anxiety, and I definitely have a few that spring to mind. And just to show the kind of wide-ranging displays of this condition, I've had clients whose dogs have made up to $15,000 worth of damage in their apartments. I've had clients' dogs who have literally bodily busted through windows, broken glass. It can be, and it shows us that this is a true panic condition, right? Because no animal would ever do anything like that unless they thought it was the safest option. But there are other things as well. We're not just thinking about those big, scary behaviors. Even, someone mentioned whining or barking for 8 hours, or not sleeping for 8 hours. Even that can be really dangerous when kind of compounded over months and years. As I'm sure Dr. Stacy deals with quite frequently in your practice, kind of dealing with the repercussions of that long-term stress on the animal's physiology. So yeah, definitely lots of things we want to be doing to proof. Most importantly, I think a camera, making sure that they're safe if they are being left alone, and then let's get to that panic, and let's make sure that they're not panicking in any space to keep them safest.
Great, thank you. So yeah, so I think that we can clearly delineate when a pet has major separation anxiety. Sometimes when separation anxiety starts to amp up, we can look for very subtle things, and these might be things that we start to look for right now as we start to adjust. Maybe the kids are going back to school, or we're starting to work maybe just part of the day out of the home, or we're just starting to go to the grocery store more. Maybe we're doing more social activities, but we're still working from home. So what are some of those really subtle behaviors that we might start to look for in our pets as we're trying to prevent separation anxiety?
Oh, I love that question, because what that really gets to is the crux of treating this behavior concern, which is we need to look for smoke, not wait for there to be fire. And so this is super important. And there are definitely some things that are important, and there are some things that aren't important. And Dr. Stacy, you mentioned myth busting. There are more myths, I think, around separation anxiety than any other behavior condition. And some things that can indicate separation anxiety, for example, are dogs struggling with the stimulus of the doorway. So we often see, I had a client actually in a private, it was a webinar that I did recently, whose sons were going back to school, and the dog was really struggling to disengage when the son was leaving through the front door, and the dog would sit in front of the front door for a really long time. They wouldn't whine, they wouldn't howl, they wouldn't destroy anything, and they wouldn't have any elimination accidents, but they were just fixated, and there was a lack of behavior. The dog actually didn't do anything. So sometimes, and like I said, it's different for every dog. Sometimes we see a decline in behavior, they stop moving. Sometimes they're pacing between the door and the window and the door and the window. Maybe they just are not interested in their favorite treats anymore when they're being left alone. That's often a sign. Alone time anorexia is something that comes in quite early on, I find, as well, because the body is physically not interested in food because it considers itself to be in such a threat, under such a threat. So keep an eye on how sensitive your dog is about that front door, and also keep an eye on how sensitive your dog is regarding what we'd call pre-departure cues. So pre-departure cues are all the things that surround you leaving. So for everyone that looks different. It could be putting your shoes on, it could be opening and closing the car door and turning the engine on. Is it the garage opening? Everyone's house is different. The ding of the elevator in your apartment building. Everyone's house is different. But I bet your dogs have not heard those pre-departure cues very much over the last 2 years, for example. So if you're noticing your dog becoming more alert to that stimulus, and becoming more, that stimulus is becoming more potent to them, that's something we're really going to need to think about. And you really do learn how smart these animals are. I have had many dogs under my private practice who are totally fine if their parents put on flip-flops, because that means they're just going to put the trash in the trash can. But when they put on their like fancy sneakers or their, you know, their nice shoes, the dog starts to panic because they're going, oh God, they're gonna leave for a long period of time, not just to go to the trash can and back for long periods of time. So really think about what your dog is nervous about, and get a camera up when you are leaving, particularly if you haven't left for a long period of time, because there's nothing worse than coming back after 8 hours and hearing from your neighbor that your dog was panicking for a full 8 hours and you had no idea. You know, it's just heartbreaking, isn't it? So we know none of us want that to happen. So definitely get a camera up preemptively to be able to see what's happening when you leave.
Yeah, those are some excellent points. I like how you point out the pre-departure cues, because there are some that are in my own home. And so at my house, it's the suitcase. My dog knows the suitcase. So I actually keep my suitcase here in my office so that my dog will see it periodically. I'll roll it out of my office, I'll roll it into my office so that my suitcase isn't always associated with a long departure. So I love that you point out that. Sometimes for our small dogs that are going to the vet in a carrier, that can be a departure cue, because sometimes they're going to the vet, that's going to cue separation. Sometimes they're going to a boarding facility, that is going to cue a long separation. So I think it's always good to keep kennels and carriers in sight, and even put treats in there so that they think they can associate it with a positive experience. So thanks for calling out all of those things. I'm learning more and more, and I'm able to put more actual names to things after talking to you today. So amazing. Let's see. So I think we should kind of dive deep into therapies, because we've identified that this is an issue for many of us. And I think it's always important to have some solutions. So what I'm thinking is maybe we'll break down therapies into kind of 3 different sections: nutraceuticals, pharmaceuticals, and behavior modification. Because what we do know is that this is a multimodal approach to solving separation anxiety. I believe that it requires not just looking at health, but it also requires full-on training and behavior modification. I noticed somebody in the chat wrote down something about, could chewing at my dog's tail be related to separation anxiety? Absolutely. But we also need to look for underlying conditions. There are some conditions, maybe even something neurological going on, maybe even a stress hormone disorder that could be causing additional anxiety. And that's something we can check for at the veterinary office to make sure there isn't something underlying. Sometimes we can provide pharmaceutical or nutraceutical intervention, but always when there's anxiety, we need to also pair that with training. So how does that sound to you, Karishma?
That sounds absolutely perfect. And I love that way of kind of dividing up the different treatment options available. And I cannot agree more with this idea that it needs to be addressed holistically, and we need to look at the whole animal, because so frequently, and we know this from our studies, there are underlying medical issues, underlying pain associated with this condition. So we definitely need to be taking an integrative approach. So yeah, take it away with the nutraceutical chat. I'm excited. I'm going to learn now.
Lovely. So folks who are watching, feel free to comment if you've tried some of these nutraceuticals, if you've loved them, if they've really worked, because nothing is going to be a magic bullet. There are some things that work for some pets, some things that take a long time to work or maybe don't work for other pets. So this is an opportunity to kind of idea share. One key isn't going to fit all locks. So these are some of the things that I've tried with some of my patients. This is not meant to be a medical recommendation. We haven't established a vet client-patient relationship, but these are just some of the things that are out on the market. So sometimes we'll use amino acid supplements, one of which is L-theanine. Another one is tryptophan. So L-theanine is marketed under kind of two different, or potentially even more, two different brand names. One's Angstine and one's Soliquin. So this is supposed to have a calming effect. So that's something that you may consider using in combination with training. Another one is tryptophan. So you may know this amino acid because you've heard about it around Thanksgiving time. So this is the amino acid that we talk about that's in turkey that makes us sleepy. So maybe this will help with anxiety. Another one that may be a surprise to you is a hydrolyzed milk protein, and that's called Zilpine. So you can ask your veterinarian about that one. There are also prescription calming diets on the market for both cats and dogs. And there are also synthetic pheromones out there. One of the ones that I've used most commonly is called DAP or DAP, and that's called dog appeasing pheromone. And it comes in a collar. So the most common use that I've had for this is for shelter pets in particular. So pets that are being adopted that maybe had a home before and are predisposed to separation anxiety. And so I say, hey, go ahead and take the DAP collar when you go to pick up your pet, put it on. It's not going to hurt. These nutraceuticals rarely have any side effects. So it's something that you can just add on as kind of a preventative measure. So that's kind of the nutraceutical story. And a lot of these you can find over the counter. Okay. What do you think about those? Are any of those kind of new to you, Karishma?
Well, actually, I work with a lot of veterinarians who specialize in behavior. And so those are all products that we have used very frequently in conjunction with behavior therapy. And they are often, from my experience on the behavior side of things, sort of at the first line of defense, like the first go-to options to give it a go. And I even, to some of my clients under obviously the guidance of their veterinarian, use multiple of these, layer them almost if it's safe to do so. I have no idea about that, but under the guidance of their vet, they have layered some to really good results. And I myself have used DAP with my own dog who has a lot of generalized anxiety, and I can tell when the DAP runs out from his behavior. So I see a lot of benefit with lots of these treatments.
Yeah, and I think that some folks will come in and say, this worked wonders. And some say, I think we need to switch to something else. A lot of times before we even start medications, we're trying, like strong medications, we're trying training, or we're even running pre-labs before we start our medication. So maybe we'll start one or more of these. And I guess I should back up and explain what an amino acid is. An amino acid is a building block to a protein. A lot of foods that we have complete proteins in them. So oftentimes we'll use multiple different amino acid supplements. So a lot of these are safe to use together, and that's something that you can consult your veterinarian about. So folks out there, feel free to check that out with your veterinarian. And a lot of veterinarians will, I know there are questions about where to get these. Some of them are available for retail, but a lot of these are available kind of in the lobby area of your veterinary office. All right, so I'm going to hop into pharmaceuticals, which are kind of the big guns for behavior. So these are behavior modification medications. So again, I always use them in combination with training, and there are two on label for anxiety. So I'm not recommending starting these. You have to have these prescribed by your veterinarian. The generics of them are fluoxetine and clomipramine. Both are used to increase serotonin in the brain. So the idea is to decrease anxiety while implementing that training program. We also have shorter acting medications for that panic state that we talked about. So I know that somebody in the chat mentioned trazodone. That's something that some veterinarians will also use. A lot of these medications I refer to as the chill pill for my clients, because it's important to recognize that there are some medications, like those 2 on-label medications for anxiety, we use them and it takes a long time for them to start to work in the body. Whereas sometimes we need something for that panic state. And so you can consult your veterinarian about what you would use for these panic state medications. The other thing that I should note is when you're using a long-term medication for anxiety, you should not stop it cold turkey without talking to your veterinarian, because there can be some side effects to withdrawing that medication right away. Okay, so those are kind of the main things with nutraceuticals and pharmaceuticals. And I keep deferring to behavior modification. So that's Karishma's main area of expertise. So please share with us kind of your main tips for behavior modification, because these are things that folks can start doing at home today as soon as they get off this webinar.
100%. There are many things we can start doing straight away. And what I wanted to go through today, kind of briefly to summarize, is our treatment protocol at CCA, at Calm Canine Academy, when we're dealing with this behavior concern. And it is the sort of one of the most up-to-date protocols. There are lots of different ways that we can address any behavior condition, but what we use has a really excellent amount of data and results by it. It's very data driven. So we really use 3 steps, one of which Dr. Stacy has gone into in depth, which is the first step to any behavior modification plan with serious anxiety and panic, which is a vet consultation, right? So Dr. Stacy talked about all the things we could potentially use. And I just want to reiterate, and I can't say it enough, how it is really our first step and how much we work together to kind of treat this. So we need to make sure there are no underlying issues. We need to get a professional's opinion on whether or not we should be adding any stress relievers, and then we can start our behavior modification plan. The first step is always a management step. So we need to manage the anxiety condition that we are seeing our dogs exhibiting, right, or our cats exhibiting. We noted, how this is a real panic disorder, and how our dogs are really panicking. They're feeling essentially fear behaviors or fear-based. Their behaviors are fear-based, and we need to stop putting them in positions where they're going to be resensitized. So what Dr. Stacy mentioned about the bag and the kennel, what she was doing was desensitization. You were bringing out the bag, bringing out the kennel, pairing it with good things, pairing it with neutrality. This doesn't mean anything scary, is essentially what you were saying to your animals in that moment. However, we can't do that if every day the bag comes out and Dr. Stacy packs all her stuff and leaves. The dogs and cats are not going to believe you when you say this doesn't mean anything scary, right? And it's the same thing with our door, with our car. So if every day we are getting in our car and going to work for 8 hours and our dogs or cats are panicking for that period of time, we're going to really struggle to see progress in a desensitization protocol. I'm sure lots of you guys mentioned in the chat, if you agree, after a significant absence where your animal was really stressed, you might notice an increase in anxiety symptoms post absence. So maybe you leave your dog for 5 hours and then you go to reach for your keys and suddenly they're really nervous, jumping on you because they see you pick up those keys. What you're experiencing there is a resensitization. Now we think about that as like a big step back, right? And our desensitization is a step forward. Now, if we're leaving them every day, we're taking steps back every single day, it's going to be really hard to see progress. So our first step is management. How are we going to not leave these animals alone until they can handle it? So this could look like reaching out to friends and family, a daycare, for example, pet sitters. If you have friends who have separation anxiety, doing pup swaps or cat swaps can be really helpful. And if you really are struggling to manage this condition in a way that's not triggering panic frequently, I cannot stress how important it is to go to your veterinarian, because that stress is going to need to be managed pharmaceutically. if nothing else, to make sure that they're not having these extended periods of essentially panicking on a semi-regular basis. So management is really number one. And once we have our management in place, we can do the most important part, which is desensitization, which is exactly what Dr. Stacy's been doing with her bag and her kennel and stuff like that, by having it out in this kind of neutral contexts. And you mentioned so eloquently, Dr. Stacy, it does not signify or predict an unsafe absence. That's what we're trying to teach our animals, right? We're trying to teach our animals that us leaving does not predict an unsafe absence, and us picking up all of our keys and our coats and all of that stuff does not predict an unsafe absence. I usually like to give people like a kind of very vague overview of this, what this might look like. And in general, I say to clients, we're going to be working for 20 to 30 minutes a day, and about 5 days a week minimum. And we do this because it just gives people easy targets to hit. Essentially within this 20, or maybe 15 to 30 minutes, depending on how much time you have, 15 to 30 minutes a day, we're going to be slowly practicing short departures with your pet. I think the biggest mistake we can make, what we want to avoid, is having, multiple years of being at home and then suddenly leaving for 8 hours. That's like, going from sitting on the couch for 2 years to running a marathon. You're going to pull a muscle, right? And it's the same for our animals. They're not ready for that just yet. So 20 to 30 minutes a day is a really nice marker to think about. And what we're essentially needing to do within that time is start to desensitize our animals to the stimulus that they find triggering, which is them you leaving through the door. So let's start with the door. And this is something everyone can start working on for 20 to 30 minutes a day. We're going to be putting our shoes on, we're going to be going to the front door, and for 20 to 30 minutes, we're just going to walk in and out. Within that 20 to 30 minutes, maybe you walk in and out 10 times. So there are big gaps in between door interactions. These big gaps help create neutrality. So it's like how Dr. Stacy has the bag out all the time. It's kind of leaking its importance out into the environment. It's the same thing with the door stimulus. So it could look something like this. You in the evening, you're hanging out, having some dinner, and after dinner, you're just sitting, maybe having a glass of wine, and over half an hour, you go and open the door, walk out, come back in, sit back down again. Something like that. You do that 10 times, for example, and you sit on the couch and watch a movie in between. We're basically teaching our dogs that when we leave, we come back. The most important thing about this is repetition, because how many instances have you guys left and then been gone? Many times, right? Your dogs associate you leaving, you putting your shoes on and leaving through that door with a really uncomfortably long absence. So people always ask me, how do I teach the dog that I come back? This is how. You leave, you come back. You leave, you come back. And we always have to do this in a sufficiently easy way that we don't trigger full-blown panic, right? So some folks mentioned that the minute I close the door, my dog starts panicking. Maybe we start by just rattling the door handle and then sit back down. And this is an important thing. And it's the same, I'm sure, with the medical side. Every dog is going to have a different prescription level. Every dog's going to have a different medication. Every animal is going to be starting this at a different level. There are some dogs that will, or cats that will start to feel uncomfortable a minute after you've left. There are others who will start full-blown freaking out before you even got to the door. So we're all going to start at a different level. So think about it, your dogs, and for some of you might want to do a little trial where you leave and watch it on your animals on the camera. But for some, you might know, okay, I can't even get out of the house. We're starting by just touching the doorknob, and we're going to do our 15 to 30 minutes, just touching the doorknob and sitting back down again. And you'll find over a week or so, your dogs stop and your animals stop caring as much about that stimulus. Sometimes this game is called The Door is a Bore. It's all about making the door boring. And that's a place every single person can be starting out at. A little bit of work every single day, just making that a little bit less scary. Over months, we'll build up to maybe, after a few months, you're able to do an hour, and they're like, meh, I don't care. And then 3 hours, and then 4 hours. And I could literally talk about this for hours and hours and hours and the details of it. But in general, that's kind of what we're looking at for this treatment period. Does that make sense, Dr. Stacy? It's similar to what you've kind of been working with your clients?
Yeah, absolutely. And I love that you call it The Door is a Bore, because while I don't like things to be boring ever, I think it's really great to kind of just channel that, like make the door very boring, make these absences boring. You know, we just need to adjust our lives to make this easy on ourselves and easy on our pets. So
yeah, for sure. I think the biggest challenge with this sort of behavior condition is the consistency and turning up every day. But when we're dealing with anxiety and we're dealing with behavior, consistency is so important, and repetition is so important. And if you enter training plans with us, we have these, you know, really rock and roll training planners where you write down everything you do every day, you keep a real track of it, and it becomes really empowering to start to see those changes. And maybe your pup at the beginning would panic when you were outside for 30 seconds, but then you can go and touch the elevator and come back and they're still laying on the couch not panicking. That's huge. That's a really big deal. So we have to celebrate the little wins along the way and acknowledge that you know, behavior change doesn't happen for any of us overnight, and we can all appreciate, you know, that, especially, you know, how lots of us have talked about how challenging it's been to go back out into the real world with humans. So our dogs are experiencing the exact same thing but in the inverse.
Yeah, absolutely. So I'd love to talk about kind of why this was important for us as Pumpkin to talk about behavior. Because we have so many questions coming in on the chat. I want to make sure we get to those and then talk about some of the things that we have in our own homes to help prevent separation anxiety in terms of enrichment. So I'll kind of lead into that. The reason it's important for us as Pumpkin to talk about this is because Pumpkin actually covers behavior conditions. So if a pet's behavior problem is covered by an actual Pumpkin insurance plan, it means that the medication, so those pharmaceuticals that I mentioned before, and then non-herbal supplements with one of those guaranteed analysis that's prescribed by one of the veterinarians that we're going to treat the behavior condition would actually be covered. So this is just an example of really extensive coverage that Pumpkin plans provide to our pets, because we know, like we talked about, when we're managing separation anxiety, it's kind of like a triad of care, right? It's the veterinarian, it's training with the trainer typically, and then it's the work of the pet owner. Because we know, like based on the chat, that our pets are getting into a lot of things around our house, and it can cause a lot of damage, and it's very scary for the pet. It really impacts them. So with Pumpkin, it has a 90% reimbursement rate. So this is really good coverage for our pets. So I've mentioned my own dog earlier in this session. So my dog's name is Professor Albus Dumbledore. He's here, and I've already given him some enrichment toys so that he would stay out there and not be too clingy with me. And so he could have separation anxiety covered by his Pumpkin plan if he developed a really severe case. So basically, this is what it would look like for him. So after his annual deductible has been met, I could be reimbursed for 90% of his covered costs, including all of these things for his behavior problems. So his office exams to go and see the vet, telemedicine exams, his SSRI antidepressant follow-up exams and lab tests, and then treatment through an eligible written referral to an applied animal behaviorist. So that would take care of the veterinary side of things. So I know that things can get kind of costly for pet parents when treating these issues. That's one way we can kind of help with that.
Yeah, I mean, that's incredible, and so often it isn't covered. So I think that's amazing that Pumpkin offers that, and 100% you're definitely going to see so much faster results when we work holistically. And it really, I love that idea of the triad, the behavior specialist, the medical specialist, and then the guardian who is conducting the work to be able to leave their dog alone comfortably. And honestly, like these the guardians that we see, they're really rock stars. They could turn up every day for their dogs, and they put the work in, and to make that easier for them is amazing.
Yeah. And you mentioned the guardians, and a lot of our guardians are at home right now. We're engaging in a digital world. So right now I'm in the Seattle area. You are many miles away from me right now.
Yes, I'm many miles away in the UK. I'm usually based out of London in the UK. So it's the afternoon for me. But we really are seeing this sort of spanning globally. Like I've had separation anxiety training. When you work with someone who specializes in the area as a behavior consultant, we exclusively work digitally, because how can we practice leaving your dog alone? What's the benefit of us coming to your house? In fact, coming to your house might make it even harder for us to do the training, because it's changing everything, and now we're here, right? So in fact, like anyone who specializes in this condition will be working digitally. And I've had clients now in, you know, all over America, Scandinavia, all over Europe, like Singapore, Dubai, India. It's spanning. Everyone is seeing this as an increasing concern. So what is fantastic about living in this digital world is that we are able to use the technology available to us to interact like this between professionals who are going to be your team when resolving this condition, between, you know, us and guardians. And it enables guardians to watch their dogs when being left. So we're using, you know, a Zoom the app, and we can use the exact same app to start working on our separation anxiety. So it's very cool how you know, we have all these new resources available to us, and how it can be used to really benefit the dogs during this time. That's very cool.
Yeah, absolutely. I love that in veterinary medicine, we're now using telemedicine and new apps. And at Pumpkin, we're always trying to use new technologies. We're able to interface this way with all of these dog and cat moms today. Are there any ways that pet parents today can engage with you further after today?
Yeah, thank you for asking. So we have a primarily on Instagram at Canine Academy, but you can also follow our Facebook page as well. We're a little less active, but we should be getting more on this platform. So our Instagram is where we have like a really quite large library of training videos, free information, and through there you can access our website and all of that stuff. We have loads of free information available for everyone, and for anyone who is looking to you know, collaborate with a professional, you can sort of look into our separation anxiety training. We have two main ways that you can sort of seek our help to get alone time success, either through private consultations in which we literally write your daily training plans. All you have to do is wake up and do it, or you can join a group class setting where with a team of 6 other dog human teams, we work through the desensitization protocols together. I can't just explain how important I think it is to get professionals on board with this condition, because I just see so many people trying to do this at home by themselves, and sometimes we see success, but behavior is complex, and we are on a clock, many of us, right? Like many of us have a time where we want to be going back to work. We're starting to open up our lives again, and this is not the time to faff. Let's really do this properly. So definitely be reaching out to veterinarians and trainers to get support that you need to see progress here. Yeah, so check us out on Instagram, send us a DM, and we can connect with you there.
Great. I know that we've had a lot of questions, and we're gonna start to get to those in a few minutes. I know that some other questions have come through the chat. Some of them are related to behavior, some are specific to separation anxiety, and some are other questions. So the one thing that I do want to mention is that Pumpkin does offer an opportunity to submit questions monthly. We take about 5 of those questions, and I'll hop on Instagram, and we will very quickly through our Instagram stories answer those questions. And so we will put a link here in our chat where you can kind of link back to our Instagram, and you'll have an idea of where we'll be posting those so that you can ask those general questions. So I know that there's so many questions out there. We'll try to stick to kind of separation anxiety today, but while you're on the computer today, feel free to follow us on Instagram so that you can access those opportunities to ask more questions. So the next thing that I would love to talk about is behavioral enrichment as an opportunity to kind of mentally enrich our pets' minds, and some of the tips and tools that we have at home in terms of tangible items and toys. So what are kind of your favorite ones that you might use for your own dog at home, Karishma?
I love enrichment toys. I use them a lot as a way to kind of meet my dog's basic needs. because if a dog has their needs met, or a cat has their needs met, sorry, I always default to dogs because I spend all day talking about dogs, but cats are the exact same thing. If we get their basic needs met, we're going to be able to see faster progress through our desensitization plan. Additionally, lots of dogs with separation anxiety, we also see guardians struggling with those dogs requiring a lot of attention, maybe connection seeking with the guardians. That can look like jumping, whining, for example. And we're all trying to work on Zoom all day, aren't we? So just like Dr. Stacy mentioned, we can provide sort of interactive toys. This usually involves their food. I have two examples just here at hand. These are my dog's own ones, so don't judge me if they're a little bit dirty. But this is a rubber Kong. So this is a rubber toy that you can kind of stuff with. It can be dry food or wet food, or little treats, and they get to kind of knock it about to find it. Or you can kind of stick a chew in there and they can chew on that chew for significant periods of time. Another example I have here is called a Licky Bowl. So you can put yogurt, you can put cream cheese, you can put wet food in here, and you can freeze this whole thing solid, and they kind of have to bat it around and repetitively lick to get that food out. So enrichment toys are often something I use in conjunction with desensitization. I often don't use them at the same time, but I will use them, maybe like I'll do enrichment to calm a dog down before I do my in and outs with the door, or something like that. And I personally really go for or push activities that promote repetitive licking, repetitive chewing. We want the dog to be like laying down and repetitively doing this activity, which kind of can really lull them. It can be very calming. Do you use similar sort of activities, Dr. Stacy?
Yeah, absolutely. And I really like that Licky Bowl that you have. I could see that working really well for German Shepherds and other dolichocephalic dogs that have long noses. My dog has a really hairy face, so that could get a little messy at my house.
You definitely don't want to do that with a flatter faced dog. I have a Shih Tzu and we won't let him anywhere near this, but this is for my poodle, so he has that long nose that works well.
Yeah, so some of the things that I kind of brought along for show and tell today, I brought one of my dog's favorite toys. We have this in a couple different versions. And so it has these rings that I can put on there in different flavors. So there's kind of an opportunity for licking and chewing, and then different types of flavors for enrichment. So that's one of the ones that I like. And then the other thing that a trainer told me when I was going through puppy training is to maybe try to give half of the kibble through some sort of enrichment. So I see these types of trays in different retail stores. So this is one that I actually bought recently. And so my dog maybe gets about 30% of his kibble in here, not 50%, because he's a really slow eater. I always worry he's too picky. But what do you think about these types of toys to kind of provide some separation?
So I love enrichment objects. In fact, I'm a very lazy dog guardian. I spend all day talking about dogs, and I have a very active poodle. So all of his food goes into these toys because I'm like, you need a job, go and do this. And he spends most of his day kind of foraging around in various toys to get fed. I don't actually use food toys when doing separation exercises for a few different reasons. I definitely use it to encourage independence and to meet their needs. And, like you mentioned, giving it to your pet so that they can work on that while you're on the phone or in the shower or a bath or something like that. I think that's absolutely fine. Sometimes, and I don't know if anyone has experienced this, let me know in the chat. Sometimes I find that if we're experiencing more severe separation anxiety, the dogs will stop eating when we practice this with whilst doing kind of actual departures. So I think there's a fine line to be just basically be careful with pushing too much with the food. So an example of this is a dog that came into my family has separation anxiety. And he would eat his mum would stuff hot dogs in the toy and then practice leaving him, and he would eat the hot dogs, but he'd also cry like whilst eating the hot dogs. And I think this is a mistake we often get into with separation anxiety and food toys, which is that food toys love food toys. I'm obsessed with all sorts of enrichment toys, but we have to make sure that we're not using the food to mask the anxiety. And I think that's very important because I've definitely experienced in the past you know, the dog that will stop eating from the food toy, because whenever they're given the food toy, their guardian leaves. So I think it's just make sure that it's happening in the right order, and that we're not doing the food toy immediately before leaving every single time, and then leaving them for longer than they can handle. So definitely use food toys. Enrich your dog's day. You can practice them being behind a barrier maybe, or in another room, for example, while you're still there. But the door, when you're doing that door as a ball game, I would rather that dog is focused on what you're doing, because I want them to watch you leaving and coming right back. And sometimes they're just like, nom, 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 and not even looking at what's happening. So definitely love these enrichment toys. I think every animal should get involved and have some, but be careful about that fine line that I discussed, that I talked about there.
Yeah, that makes absolute sense. And maybe it's more of a preventative measure too.
Yeah.
I like the story about the hot dog. I will tell our viewers out there that the hot dog does worry me too, because they can be high in fat content. That might be a little bit too much for a dog, and we want to be cautious about pancreatitis. But
of course, yeah, I have no specific recommendations of what food. It was just the highest value thing. Even that, well, the idea was that even that really delicious food was not enough, and actually was causing harm in the long run. Yeah,
you would think that dog would have been in heaven given the hot dogs. So
exactly.
All right. So what do you say we jump into some of these questions, because we have these amazing pet parents on here? Let's maybe answer some of their questions. So So some of the ones that we have are, so how do you differentiate the door being a trigger for anxiety versus being excited to just go for a walk or go to the park or do something fun?
This is such a good question, I think. And I think that we often see this kind of hyperactivity in dogs as excitement, but hyperactivity can also be associated with anxiety indicators, or can be an anxiety indicator. I think my big thing here is there are different pre-departure cues for a walk and for when you're leaving to go out. So picking up your dog's leash, for example, their harness, getting your poop bags maybe, these all indicate a walk. Putting your shoes on, packing your work bag, and leaving without the dog, that's definitely going to indicate to them something different. So what I would suggest you do is you film your dog when you're leaving them alone, or watch them when you're leaving them alone, so you can see what the difference is, because there definitely is a difference. So often we'll see, you know, hyperactivity kind of associated with a loose loose body, loose musculature, happy, relaxed smiles. That usually indicates like feeling comfortable and excited. But when we see this, like, you know, often we see wide eyes, extreme tension in the face where it kind of looks like they're smiling, and they often have their tongue out panting, that we have to be careful, because that often can be indicative of anxiety. So I would probably use viewing equipment to view your dog before you take them on a walk, and then view your dog when you leave them alone, and have a look at the difference in the body language, and see what is different, because every animal is different. I can't kind of say every dog that looks stressed looks like this and every dog that looks happy looks like this, because that's not really how it works. But definitely use a camera and have a little look and become interested in your dog's body language and your cat's body language. There are so many great resources available. If anyone is interested, just hit me up, DM us, and we can send you some useful sites to learn about body language.
I like what you said about reading their body language, because I think that's so important, and that's something we have to study a little bit to be able to understand them. Speaking of body language, we had one of our viewers mention that she or he does suffer a little bit with anxiety too, and so she wonders if she can pass this anxiety onto her dog, and if her dog can pick this up. I have some thoughts on that. What do you think?
Yeah, I mean, there are, from like a data-driven perspective, there is definitely a case to be made for co-regulation between bonded animals and like bonded mammals, right? So I know that my dog is very, very clued into my body language, and dogs with separation anxiety do tend to be extremely observant of their guardians, because you are their safety line. You make them feel safe, so you're very important to them. So I definitely do think that if you're extremely anxious and showing overt signs of anxiety, our dogs can pick up on that. I wouldn't extend that so far as, you can't even say goodbye to your dog when you're leaving. However, if your voice is tense and high and strangled and your heart is beating fast and you're, sweating, your dogs know, your cats know as well, which is why I love the door as a bore game so much, because the door is a bore for you too. And it should be a bore for all the animals involved. So if you're going in and out of the house for 15 minutes to half an hour a day, very quickly, you're desensitizing yourself to the process as well as your animal. The co-regulation takes place holistically between both of the animals involved. I also really recommend box breathing to lots of my clients, particularly clients who struggle with dogs with their own anxiety, which is where you inhale for 4 seconds, hold for 4 seconds, exhale for 4 seconds, hold for 4 seconds. It's a simple breathing technique that they originally developed it for fighter pilots, but anxious dog parents, fighter pilots, it's the same thing. So I use it a lot with my clients who struggle with their anxiety. So you can Google that, box breathing, to keep your body regulated. Dr. Stacy, do you have similar sort of ideas about this, or what have you experienced?
Yes. I think that sometimes being a pet parent, it can be like being a fighter pilot. I like that analogy, but I would agree. So there's this movement in veterinary medicine called the fear-free, and we talk about changing our approach to pets coming into the vet when they're fearful, and not necessarily having that high-pitched voice where we're welcoming them and kind of getting them amped up, and instead having kind of a softer approach, a really kind of monotone, calm demeanor towards them. So that really matches with what you're saying. Also, we can get really amped up in the morning when we're leaving for work or school. Sometimes there's a lot of bustle in the home, especially when we're making that transition back to work, back to school. So I always recommend that folks do some trial days. Pack the lunch for the kids in advance, walk to the school bus, take the dog to doggy daycare if that's something that your family does, so that you don't have all of those major changes all in one day. Instead, transition so it's not such a shock to your pet, because we'll get anxious too, and our dogs will, I think, sense that.
Yeah, I definitely 100% agree. Any way that we can split this up for them so that it's achievable, the changes that we're presenting to them, and in small doses, the better we're going to be. And that's really the main preventative step that we can use, I think, is to start now. Start now with your enrichment toys in the house. Start now with your door into the ball game. Start now introducing a dog walker or doggy daycare once or twice a week, so that it's not suddenly all the change all at once. I definitely agree with that.
Okay, awesome. So let's see, we had another question. Let's see. So we have a viewer who, let's see, it's in a multi-dog house.
I have a really good one here.
Okay, yeah.
I think would be really helpful, and one that I get so frequently, and I think this is definitely worth discussing. So is it a good idea to leave for a few minutes, the pup goes crazy barking and jumping on the door, and then return about 1 minute later to calm them down? Does this help or hurt? So we definitely don't want to be triggering the cycle of anxiety over and over again. Imagine it this way: you have a phobia of water. You're very scared of water, and you're going to go to the therapist, and the therapist is going to slowly introduce you to the swimming pool, over a series of weeks and months. If the therapist suddenly pushed you in the pool in the middle of week 1 and you were submerged and the water went up your nose and you had a panic, you're not going to trust the therapy process, and you're probably going to be more nervous in the future around the water. It's the same thing here. If we kind of push our dogs in the deep end by leaving them to panic repeatedly over and over again, we are solidifying their expectations that alone time is scary, or in the case of the aquaphobia, that water is scary. We are resensitizing over and over again. So when we're doing the door as a bore game, I mean, the hint is in the title, it's boring. Our dogs should not be panicking. They should be calm. And that's why we do this for 15 to 20 minutes every single day. And that's why we do it in conjunction with a veterinarian and medication often, if appropriate, because that way we see faster progress, because it can take repetition sometimes to change behavior. So yeah, definitely don't want to be kind of pushing them into the panic state and then returning once they're already panicking. And we definitely don't want to be repeating that too much. We want this to be sub-panic, sub-threshold. All right, should we do one more question, Dr. Stacy? There's this one about the multi-dog household. So yeah, shall I read it out? Okay.
So
go ahead. No, go ahead.
I read some of the background in the long chat, so I'm happy to queue up that question.
Go for it.
So say for example, there's a multi-dog household and there's a foster dog in that multi-dog household who has separation anxiety, and that pet is going to be rehomed to a new home. How do you have any tips on how to help that pet with separation anxiety given that multi-dog household? Maybe one or two tips.
Yeah, this is a great question. I actually am going to direct you to a webinar that I recently conducted with Muddy Paws Rescue, which is all about separation anxiety in foster dogs and recent adoptees. But I'm going to give you the biggest piece of advice here, which is that we cannot treat separation anxiety in a foster home. It's too soon. Most dogs in a foster home are only going to be there for a few months. And really, as most you'll probably know from fostering, it takes a good amount of time for an animal to settle in to a new environment. Additionally, often we see progress regressing when the animal moves house into the new home. So what progress we do see often gets lost. What I would focus on is making sure that dog is thoroughly examined by a veterinarian. I would get this animal on medications if the vet says it's appropriate to manage this anxiety condition, provide lots of enrichment for the animal, give it the best care that you possibly can. You might want to start working on some training skills that do not trigger the anxiety, like, a relaxed bed stay, for example, maybe some confinement training. But we're really going to have to be waiting until the dog is settled in a permanent home or settled in the foster home for a series of months before we start working on this. And remember, separation anxiety training, we're talking about months, not weeks. So unless we can commit to the protocol for multiple months, there's really not much point. And I find that in 90% of fosters, we're unable to achieve that. So it sucks. I know we want to do everything we can to help, but sometimes patience is the best thing that we can offer, patience and compassion, and then the appropriate medical care and management of the condition until we can get into the home that will be where they can actually do the therapy.
Yeah, I think that's a great point to end on, because again, it's that multimodal approach. And in this case, it's probably not even a triad, it's a 4-part approach. It's going to be the veterinarian, maybe getting that pet on medications early, because those medications are going to take a long time to start working with a trainer, working with that committed foster who's helping this pet to find a home, and then ultimately that end home that pet parent will, or that pet will end in as a new family. So thank you so much for your time. Thank you everyone for being here and joining us. I hope that we can do another topic again in the future. If you love this, please let us know so that we know to repeat this again in the future. Again, Karishma, thank you for your time. Please visit her on Instagram and other forms of social media. And I think that's it for today. Any parting words?
Thank you guys so much for having me. It's been an absolute honor, Dr. Stacy. It's been a pleasure, and thanks for your amazing questions. I hope to see you guys around.